Future Design Podcast.
Hi everyone. In this episode we have Dr. Erin Smith, an associate professor at the Edith Cowan University specializing in disaster emergency response. Her mission is to improve the mental health and well-being of the emergency first responders and healthcare workers and has an astounding record in developing curriculums around the subject. Hi, this is the Future Design Podcast, and today I have Dr. Erin Smith with us today. How are you doing, Dr. Erin?
I'm very well, thank you. Thank you so much for having me.
Thank you for coming on to our show. Now, you're in the front lines, or at least you're managing people who are in the front lines of the hospitals, the frontline responders, healthcare workers in Australia at the moment. Could you tell us what is going on behind the scenes at the moment?
Yeah, so I've been working for probably the better part of 2 decades now with first responders, doctors and nurses, really within that disaster context. And most recently here in Australia, we've just done a big national survey of paramedics, doctors and nurses that we really wanted to get to the bottom of what their main concerns were about working in the middle of this pandemic. And what we found was really interesting actually and pretty concerning in that the majority of people who were in our survey, so we had about 700 people complete our survey, and overwhelmingly around 80% of those were starting to be very concerned about working in the middle of the pandemic. They were really starting to weigh up that balance between their professional obligation to work. So we need to remember that the people who work in these kind of industries, they're real carers. You know, they're empathetic people. They're wanting to work in this line of work to help people. But then you've got this kind of situation where all of a sudden actually doing their job places them at risk. So they have their obligation to turn up to work, but just by doing that, they're actually at risk of being exposed to this potentially lethal disease. And when we look at the statistics from around the world, we know thousands of frontline healthcare workers have already been exposed and hundreds have died. So we know that that risk is actually a very real threat to not only them, but they can then take that risk home and actually give it to their loved ones. So we know, for example, nurses in New York City have become infected at work and then gone home and then gone on to infect their family members as well. So it's very concerning. So here in Australia, we wanted to really find out what was happening with our healthcare workers to see what their concerns were. And not unlike around the rest of the world, they were having real concerns accessing their personal protective equipment, so the PPE that we're talking about. So at least half of the survey sample that we spoke to were having real concerns about accessing things like gloves, face masks, gowns. For weeks now, some hospitals have not had any hand sanitizer, for example. So we're expecting them to be on the front lines, but we're not even providing them with the basic protection to do their job. So they were just some of the basic things that our survey was finding, that they can't access their PPE, and they're now starting to question whether they're actually willing to do their job.
And why is there a shortage of these PPE and other supplies that is very necessary for these healthcare workers to continue doing their work?
Look, and it's certainly happening around the world. Here in Australia, it's been a little bit of a perfect storm. So you guys might have heard that here in Australia at the beginning of the year, we had these unprecedented bushfires. So right around Christmas time, we had horrific bushfires that burnt an area the equivalent of the Amazon rainforest. So we had really, really horrific bushfires that we had already sort of dipped into our national stockpile of the face masks, for example. So we'd already dipped into that stockpile. And then before the bushfires had even really stopped, along came this pandemic. And so we then started madly trying to scramble to find additional supplies. But at the same time, everyone else around the world was also needing to find supplies. So it wasn't really as if there was any country in the world that was not impacted by the pandemic. We couldn't go to another country and say, you don't need your supply, can we borrow yours? And at the same time, most people were also relying on China being the largest manufacturer of PPE, but they were the first country that was most devastatingly impacted by this. So they didn't really have a lot of supplies to be providing at that point in time. So we're slowly starting to catch up, but it left us with a real hole in our supply chain. So the supply chain issue was one big factor, but then we also had this big issue where we hadn't really thought about the distribution either. So we're kind of learning on the hop here, and they're really things that we probably should have known. We've done all these tabletop exercises. Everyone's done pandemic planning. Any kind of tabletop exercise has said logistically that PPE supply was going to be an issue. We probably hadn't thought so much about the distribution aspect. So once we get these supplies finally coming through, which here in Australia we finally are, we're seeing all these warehouses now full of PPE, but how do we actually figure out how do we get them to the people most at need? How do we determine priority? Which hospitals need them and how do we get them to those people? So it's that whole balancing supply and distribution at the moment. And domestically as well, we just we weren't actually producing enough PPE domestically. So I think that's a big lesson learned for us here in Australia. So they'll certainly be looking at that after the COVID-19 pandemic.
These PPEs, initially, how much of stock did you actually have in a hospital? I mean, it's obviously it's not for everybody, or all the nurses, all the doctors. It was probably allocated or supplied for several people. I mean, what do you think is the percentage of the PPEs were available to the hospitals and that were dealing with the COVID-19 situation?
And that's a really interesting question. That's something that has been raised to me over and over, is that we can't get a simple answer to that. We don't know what was actually in our national stockpile. So at the national level, there was meant to be a stockpile of PPE, and we can't get a simple answer as to how much was sitting in that. And we don't know what each hospital actually had in their stockpile either. So that's a big lesson learned as well, is that there's no transparency in terms of what was actually sitting there before the pandemic even started. And then that's been one of probably the biggest critiques and criticisms of the healthcare workers, of their employers, is that the employers, being the hospitals, haven't really been forthcoming and transparent about saying, listen, this is how much we have and this is why we need to ration it. They pretty much just jumped straight to rationing and saying, you have to wear your one mask for an entire shift. Whereas previously, they would have been given a separate mask for every individual patient that they saw for an entire shift. So that's a massive change of protocol for these individual healthcare workers. So, you know, they've all of a sudden they feel like, hang on, we're working in a really different threatening situation, and I kind of feel like you don't have my back. As my employer, are you really protecting me? Because all of a sudden, you're making me wear this one mask for an entire shift. And I know that that's not really protecting me. So I feel like you're putting me at increased risk right at a time where you should be actually going above and beyond to actually protect me more. So that's what's caused this real level of angst amongst some of our healthcare workers at the moment, is this real lack of transparency around how much PPE there is and how long it's going to last for. And that's still happening right now as we speak.
And do you think that's a function of the government actually not really even knowing, you know, how much stockpiles they have? Because I don't think there's a warehouse somewhere that stockpiles this and that's controlled by the government. They probably, you know, have been distributed, or it was done by the hospitals themselves. Why do you think this whole issue of transparency came about?
Yeah, I think everything that you mentioned, and I think I've spoken to doctors and nurses working in GP clinics who were then communicating to their powers that be, saying, trying to put in orders, being told, well, we don't have it. And they're like, well, how can you not have it? We're meant to have a national stockpile. And it was kind of like no one knew the answer. And it was, well, who does the buck stop with? You know, who has the answers? And no one seemed to have that answer. And it's like, well, where is the transparency here? Who does the buck stop with? We need to know who has the information, and it just doesn't seem to be clear at the moment. And I think when all of the dust settles after all of this, there will need to be some kind of commission around this to say, right, what happened with the national stockpile? was it just something that existed in name alone, or was there actually a physical stockpile in a warehouse somewhere that just didn't have as much as it was meant to have? Where was the spreadsheet that actually listed what was meant to be in it, and did that actually, correlate with an actual warehouse with physical supplies somewhere? Yeah, we're just not quite sure where the breakdown has occurred. But what we do know is that in reality, at the individual level out at hospitals and in GP clinics, it has manifested into not actually having enough PPE for individual healthcare workers to feel safe about going to work and doing their job. But what's been really interesting here in Australia is this is only really happening for the doctors and nurses in hospitals and GP clinics. Our paramedics, on the other hand, tend to feel really satisfied with the level of PPE that's being provided. So the ambulance services seem to have been doing a really good job in providing the PPE. So there's differences there. Where the ambulance services seem to have been coming under fire a little bit is in the way they're communicating with their staff. So what we're hearing from our survey results is that the paramedics aren't happy with the way that the ambulance services are communicating with them. So they're still quite willing to work. They are happy with the level of PPE provided, but they're not happy with the way the services are communicating with them throughout the pandemic. So there's different lessons for them in terms of what's happening throughout the pandemic. So that's been really interesting for us to see.
And do you think the ambulance services, because it's run by the government, they have a different distribution source compared to the hospitals where they have to actually go to suppliers that actually create the PPEs, the face masks and hand sanitizers?
It could very well be due to the different kinds of sources and providers of the PPE compared to the ambulance services compared to GP clinics and hospitals. But it's just been very interesting to see that when we've been asking our survey participants about communication, that for some reason the paramedics have just not been happy, and that's ambulance services right across Australia. So here in Australia we have state-based ambulance services, and it hasn't been specific to one individual state. That's right across Australia. So that's been really interesting, and that's going to be something that ambulance services will need to consider and go, well, where have we been failing? What's been the issue with our communication to our employees, and where have we been letting them down compared to the hospitals and the GP clinics? So that's been an interesting finding, and they'll need to dig a bit deeper to see where that's been lacking.
And how do you think this supply or getting these supplies would change going forward? Because obviously it seems like everybody has their own source, or they're not going to the right source. Maybe the government doesn't have control over all the sources of these equipments. So after all this, after the pandemic, we probably need to rethink how we're going to be, getting our supplies of these protective equipment, and also how to distribute them to equally to all the hospitals and ambulance services and everybody who's in the front lines. How do you see this structure changing over time?
There's a few important things to consider. So I think it's really easy for us to jump to the first sort of what seems to be the logical conclusion, and that's just to have more PPE. But I think we need to remember that particularly here in Australia, it has been that perfect storm, as I mentioned, in that we had the bushfires. So we had already used a big chunk of our stockpile. And then with the pandemic having such that a big fear-induced component as well, we saw a large component of our community rush out to buy a large number of face masks, where we, here in Australia particularly, we're very different to the United States and other countries where there have been, instructions coming out from the government saying you have to wear face masks. Here in Australia, the guidelines and instructions from the government have actually been directly different to that. They've actually been saying, unless you are symptomatic or unless you are a healthcare worker, you do not need to be wearing a face mask in public. And actually, because we are so short on PPE, we've actually been really saying, please leave those PPE masks and things for the healthcare workers, the people who really do need them. But we have still been seeing people who probably don't need to be wearing them using them. So maybe that's also been taking up some of those really important supplies, particularly in the early stages of the pandemic where we were really short of supplies. So I think one of the biggest lessons for us as well is around public education. And I don't think we did that very well here in Australia in the early stages of the pandemic, around educating the public around when you would and wouldn't need to wear face masks, for example. We had people, for example, wearing the same paper-based face mask for a month on end. So, that's not actually helping you if you're just wearing that same mask in and out of everywhere you're going. It's saturated. If it's got virus on it, you're actually doing yourself probably more harm than good. Wearing the same pair of gloves in and out of everywhere that you're going is actually not protecting yourself. So I think it's around educating people around how to effectively wear PPE as well. But back to actually fixing that whole supply issue, I think it's the government will have to sit down and look at whether they ramp up domestic manufacturing as one particular stopgap in the future, and just try to think about how we actually make sure we have a better supply and a distribution around that in case, we can't say this is never going to happen again, that this is a 1 in a 50-year kind of event and that we'll never have to worry about it again. We may have to deal with something like this again. So what would we do to fix this in the future? So it's, ramping up domestic manufacturing and trying to figure out, what we did have issues this time as well is that we started to bring in things from overseas, but because of all of the border control that we put in place, things that were coming in, for example, from China, were sitting in quarantine for 14 days. So trying to speed up processes, looking at ways that we can maybe get things in a bit more quickly as well in the future. So there's lots of things that I think, lots of lessons to be learnt around both the supply chain but also the distribution chain as well, moving forward from here.
So let's go back to the anxieties and the worries that people have who are in the front lines. What are they experiencing? Because if they don't have the protective equipment and they're wearing the same masks for a whole day, and as you said, there might be viruses all over the face mask. What are their concerns at the moment, and what are they feeling about how to cope with this situation?
Yeah, look, obviously they're going to be worried about getting exposed to the virus at work. But what we found overwhelmingly within the research that we've been doing is that they were actually more worried about taking that home to their loved ones. So right at the beginning of the pandemic here in Australia, some of the biggest concerns were that their employees weren't doing a lot to support them in terms of being able to safely isolate away from the home. So they would go to work and do really long shifts. They weren't getting access to things like hand sanitizer, basic face masks and gowns. And then they had to go home and potentially then expose their loved ones as well. As the weeks and months moved on here in Australia, most of the state-based governments did actually come to the party and start to provide free accommodation outside of the homes. So a lot of hotels here in Australia started to provide free accommodation to those on the front lines and in essential work kind of roles. So that was a fantastic initiative here. So if you couldn't go home or didn't want to go home for fear of exposing your loved ones, you could go and stay in a hotel for free, which was fantastic. But for a really long period of time there, a lot of our healthcare workers and frontline workers were really fearful of going home and exposing their loved ones. And we certainly have seen that around the globe, where, as I mentioned previously, that some of our healthcare workers certainly did go home and go on to expose their loved ones. So that certainly raises levels of anxiety and concern. And they're also exhausted. We have to remember, for most of us now, we're into our sort of second month of this. So that's a really long time to be living in this level of hypervigilance and high level of concern. And so even if we didn't have pre-existing mental health conditions, some of us might have even started to develop these stress disorders. We could even be exhibiting the post-traumatic stress symptoms, and we're still in the middle of the traumatic episode, but we could be certainly exhibiting those symptoms already of that traumatic kind of symptomology. So, trouble sleeping, that general constant anxiety, just fearfulness, and that constant hypervigilance, and living in that state of just not quite being able to just relax and calm down. And particularly not so much here in Australia, because we have been incredibly fortunate. We haven't seen the huge case numbers that our colleagues in the United States, the UK, Italy and Spain have seen. But they're seeing huge numbers of cases, huge numbers of deaths, and they're seeing them on a daily basis. And I can't even fathom what that is doing to their mental health. And so we talk quite regularly now about the potential for a second pandemic after this, and that's going to be a pandemic of mental health amongst our frontline healthcare workers. And we need to be so careful about monitoring their mental health and their physical health, because a lot of them, as I said, are becoming physically exhausted, and they're working back-to-back shifts. They are not getting very many breaks at all. They're taking on the role of carer and family member as well, because we need to remember that because of the nature of COVID-19 and being so infectious, that family members aren't allowed into the EDs and into the ICUs. So as these people are dying, the nurses and the doctors are sitting with these people. They're being the last person that these dying people are seeing and are talking to. So just the toll that takes as well. And it's a cumulative toll as well, because they're doing it every single day. And so, yes, the mental health impact of this is something I don't think any of us really want to hazard a guess as to how widespread and how big this is actually going to be.
I heard cases where in Italy that because there was a lack of ventilators, they had to choose which one gets it and which one doesn't. And having to decide on that kind of issues is not something that you can really cope with on a daily basis, right? If you had enough ventilators, then you would have been probably been able to save them. But because there's a shortage of that, you're deciding, okay, today this person or that person lives.
Our healthcare workers are trained on an individual level to do what we call triage. And so that is to make the decisions for the greatest good for the greatest number of people when we have a typical kind of disaster. And, so generally we might be talking like something like, a multi-incident car accident or a train accident, or, even something like the 9/11 terrorist attacks, for example, where you had that mass casualty situation. And we're usually talking about traumatic injuries, things that you can see, people with, that trauma. But with something like a pandemic, you're talking about an entire population that needs to be triaged. And all of a sudden, you have to make really, really difficult decisions that become huge ethical dilemmas. And how do you actually determine who gets care and who doesn't? And in Italy, they were the first country that really had to make those really terrible ethical dilemmas. And essentially what it came down to was, unfortunately, pretty much anyone over the age of 60 didn't get a respirator, as you were saying, didn't get ventilated, and anyone with really bad chronic comorbidities. So for myself, I'm a really severe asthmatic. I have an underlying heart condition, and I've had cancer in the past. So if I turned up, I'm under 60 years of age, but because of all my chronic comorbidities and the fact that I have terrible lung disease and a heart disease, I probably would have been not given ventilation because of all of my issues, because they would have looked at me and said my chances of survival would have been much lower than somebody else's. And that's actually really scary to think that, wow, if I was in Italy and got sick, I probably wouldn't have been saved. And they're the horrible decisions they were being forced to make. And they're the kind of ethical things that I usually give to my students as philosophical debate questions as part of their studies. And now all of a sudden, doctors and nurses were having to make these decisions in real life every single day. They had patients lined up on stretchers in every single hallway. They were converting operating rooms, and every spare room in hospitals were being converted into temporary ICUs. They just were running out of room. doctors were operating in roles that they hadn't been trained in because they just didn't have enough staff. And you can only imagine the stress that all of that takes. And even though there were guidelines that existed to say, yes, this is the ethical triage guideline we are now going to follow, that still doesn't help at the end of the day to know that, yes, I turned people away that on any other day I probably could have saved. So, yes, it's just the mental health impact of that will be profound.
And how are they trying to cope with these people? I mean, right now, I'm sure they're very busy attending all the patients, but after this, what kind of help do you think they can get?
Absolutely, there will need to be mental health support for everybody on the front lines and all of us at home as well. There will need to be so much mental health support coming out of the pandemic to try to get us back to normal. But I've had some really interesting discussions around that and whether we even go back to normal after this or whether that's possible. I think there's going to be a new normal after COVID-19. But in terms of our healthcare workers, I think there will be so much what we call hot debriefing in terms of just sitting down and talking from that operational perspective. So talking just purely operationally, how did we go, and talk about it from that perspective. But then from a psychological perspective, I think we will need to do a lot of what we call psychological first aid and just really sit down and say, what do I need from my own mental health? What do I need right now to be able to cope with this? And what are my immediate needs? Do I need to be able to go away and speak to somebody, or what support do I need to be able to move forward from this? We used to really favour something called critical incident stress debriefing. That was certainly in favour after the 9/11 terrorist attacks. And that was where, for example, psychologists would sit down with say, a first responder right after the attacks, and they would sit down and they would talk about exactly what happened. But the overwhelming evidence now suggests that by reliving a really traumatic experience too soon after it's occurred can actually do more damage than good. So I think we probably won't see anything happening in the immediacy in terms of reliving things, but there will be a whole host of psychological therapies that will be available to the first responders. And it will be trying to figure out what kind of supports will work best for individuals in terms of well-being and moving forward from this to make sure that post-traumatic stress symptoms don't become post-traumatic stress disorder. And that's certainly what we will be trying to avoid moving forward.
Yeah, they're the heroes of this time. Without them, then none of us can come out of this COVID situation alive. And we really need them to heal up because, they're the most essential workers out there. Thank you very much for your insights, and it was very valuable to us. And I hope to talk to you again soon.
You're so welcome. Thank you for your time.
Hi, this is your host Takatoshi Shibayama. Thank you for listening all the way to the end. Now, if you enjoyed or disliked this show, please let me know by writing in the comment section. The only way I can improve or add value to you is through your voices. If there are any topics that you would like me to pick up, please also let me know in the comments. I'd love to start chatting with you all. And if you would like to continue watching the show, please subscribe. Thank you.